So good morning, everybody. I hope everybody had a good sleep. So I'm just going to barrel on in here. I want to, first of all, thank our partners who are helping us in the organization, but also in the conference, and also specifically with this project. I know I've mentioned this before, but really everything that we're doing in this project comes from the work and the voice that we heard, the need that we heard very strongly from you, that nobody understands the real impact of living with the diseases that we live with. And that you and we all needed a combined voice, and we needed access to tools that we could use to convince the people around us, the decision makers in our world, that what we feel and what we experience is real and is important and is impactful. So therefore, why data? Why do we need data, and why specifically this approach? So health technology assessment, and actually our next session is going to talk a little bit more about that, but the people who make decisions about which medications, which treatment options are available to us, they want to hear from us. We are an actual important voice, or more growing to be a more important voice to them as they make their decisions. But what they need is credible information from us. And when we tell them our stories, as impactful as those are, they can't fit those into their measurement rubric, or the way they add their numbers, because they use numbers. And so they make their decisions using data. So we need to speak to them in the language that they speak, because while they appreciate it when we speak the language that we speak, they can't use it. And we also want to do this because we want to stimulate. We want the numbers and we want to be able to show that these diseases matter so much that pharmaceutical companies, that researchers will say, oh my gosh, I had no idea that EB or that lichen sclerosis or that PRP, that these diseases really impact people, and oh my gosh, we should get some research going. And if we can stimulate that, then I think we can change. We can hopefully change, and as Gita said yesterday, we can have cures, and I'd like them not by 2050, as I said yesterday. So what's unique about this project? Well, actually, so far everybody we've talked to said this is actually quite unique. And yesterday I mentioned that it's a multi-part project, but the first part of it is that we're looking to create a new measure. And Chris Bundy talked about various measures, quality of life measures, being not quite adequate to capture what it's really like for us to live with these diseases. So this tool that we're using that actually goes out and asks for the patients to essentially come up with the questions themselves is completely unique. That's what we believe, and we've got actually part of our research now is checking to make sure that we can accurately make that statement. It's also not just happening in one country or in one region. The plan for this is that it be global, but that the information is also going to be able to be cut locally, regionally, and globally. The other thing is, it's not just about one disease or two diseases. It's about all of our diseases. And so when we then, again, join our voices together, we can then say skin diseases matter. It's driven by us. And the thing about research is there's always a talk about there being some kind of bias, researcher bias, scientific bias. In this case, what we're going to inject in is, I think you can't do any research without some little bit of bias. The bias that we're going to inject in this is patient bias, which I think is actually going to be appreciated as long as we do it very, very carefully and correctly. New measure, we will collectively own the data, so it's not going to be something that somebody else owns, and we're going to provide the results and the data to any member, to any contributor, to anybody who's part of our process. So that is what I think is unique. So what's in it for you? Why would you do this? because we believe this will give you increased credibility. When you have those numbers, when you can say this is how much it impacts our people according to these measures that they themselves have come up with, then you're going to have a really super strong tool. Also, when you're out trying to talk to people who might be members, who you want to reach, it's great when you can say, hey, 70% of the people who live with our condition, or 62% or 90% feel this. And those people who hear that will go, oh my gosh, I feel that way too. And so you're actually going to be able to connect better with the people who are in your group, or who you'd like to have join you, because you've got some data points that provide that inclusion. The media loves numbers. The media loves to have numbers, and it loves to have new information. So when we come out with this, and you can then say locally, I'm in South Africa, and South Africa looks like this for these patients, but compare that to what's happening in the Netherlands or elsewhere around the world, or compared to the rest of the world, you're going to be able to say, hey, South African government or Netherlands government, why are you not doing this when everybody else is? So you can use, and Christine probably talked about this yesterday in the report card session, you can use data from one to show what others are doing and how people feel in other regions, and compare those and maybe impel action that way. We also know that our sponsors like it when we're really good at advocating, and they like it, and patients and families like it when we're standing up for them. So the more credible we are, the more effective we are, the more that builds that fundraising. And finally, psychologically, I think it's going to make a huge difference if we can stand together and we can show the people that we serve and we ourselves that we are not alone, that we are all in this together. So this project and the numbers and the data it brings. So we've broken it out into 5 phases. Phases number 1 and 2. Phase 1 is actually the pre-stage, the design stage, and where also Nero, who's here, and her team are looking to see what's out in the literature, what's already been done. Can we make some of these statements and have them be valid statements? Are we really truly the first and only? And then also developing and designing the GRIDD tool. And the GRIDD tool, which is the global research on the impact of the impact on patients. So this tool that we're developing is the first piece that will go out, and I'm going to talk a little bit in a second what that actually means to you. Phase 3 is the actual GRIDD part of the project, when the research itself will go out, and then finally phases 4 and 5 is when we get the data back in, it gets analyzed, it gets coded, and then the reports get written, and we then go out with a massive campaign, both locally and globally. So that's the summary. That, and I'm sure the people at the back cannot read it, but it's included in you'll be able to read this later. There's a lot more detail about the phases in that slide, and I'm just flashing it at you. So phase 2 and you. These are the steps, and what's in bold are the bits that I think are going to involve you. And I think the one thing that I want to really stress is that I know that you're all working in small organizations and you're all stretched and you have no time really to do anything more. And we get that. So what we're going to do is as we involve you in this, we're going to make it as easy as possible, and we're going to send you materials and resources, and we're going to listen to you. And when you say, I don't know how to do that, or I don't know how to reach people, then we're going to work with you on that. And so that's going to take a lot of our time and a lot of our resources, but we're really very committed to this, working with you. And so the key piece is that we're doing this in consultation with you, and we need to hear from you. And so we're going to ask you. So step 1 is we're going to ask you, how do you reach your patients? What do you need? How can we help? Then we're going to develop this package, the tool, and we're going to test it. Then we're going to make adjustments for language, for culture, because we recognize that something that's going to be released in Poland might need to look different than something that's coming in South Africa, in Bolivia, et cetera, et cetera. But we're going to do that in collaboration with you. So you're going to get the actual tool and the package that's going to help you do that. And we're going to get you to ask the patients what issues matter to them most. So we first thought we were going to ask the questions, get you to get them to give us the questions, but we realized that's probably too hard, and that's actually Christine's input. And then we're not sure whether the information should come back to you, or if that's too much of a burden, or if it just gets sent back to us. And then the research team uses that to create the actual GRIDD measurement instrument. Again, phase 3 then is sort of a repeat of phase 2. A consultation with you. We're going to say now what worked the last time, what didn't work, and we're going to adjust. Then the GRIDD instrument, the actual measure that's going to go out and measure what it's really like to live with this disease based on the questions that your people came up with, is going to come out, and I'm at number 4 here, after it's been tested and adjusted for language and culture. You're going to get a GRIDD questionnaire that's specific to you, your country, your disease. And the data in this case is going to come back directly to our database, and then will be coded and analyzed, and that's actually phase 4. And then phase 5 will include the next conference. And at that conference, we're going to really work on with you how best to leverage that data. And so a lot of the focus at that conference will be about advocacy, about awareness campaigns that use evidence. So also we're expecting to present some papers. We may not have all of the data fully in by then, but that's the point at which we're going to roll out evidence-based campaigns. And I really want to emphasize that you will get a full toolkit. You will get a full, wraparound support according to your needs. So we're going to work really closely with each and every one of you. And that sounds like a big task, and it is a big task. But we think it's worth it. So never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So, said by Margaret Mead. So, this is our plan. This is our dream.
Thank you so much, Christine.